And I am going to ask that they take a moment to introduce themselves in addition to my opening remarks. Jenny.
Thank you so much, Lourdes, and thank you so much to St. David's Foundation and to everybody for inviting us this afternoon. I am really thrilled. I love Central Texas, just so you know. Been out there a couple of times, been connected through working with Paula and Mama Sana Vibrant Woman, and many of our colleagues and partners in the work are located there. Thank you very much again for having me. I'm the founder director of Common Sense Childbirth Inc., which is a 501c3 nonprofit, and I'm in Orlando in the Central Florida area. And the National Perinatal Task Force grew out of the work we were doing at Common Sense Childbirth. I've been working inside of midwifery. This is literally my 40th year this year. I graduated in 1981. And yeah, it's been a long time, but I wouldn't do anything else. And I've never done anything else. But as a midwife, when I arrived in Central Florida, I got off a plane. I had Disney stars in my eyes. I thought I'd come to live the life. The streets were paved with gold. And I was happily looking around for work as a midwife. And it didn't actually come to bear, because even then in 1989, midwifery was still very fringe, very like, oh, no, we don't do that anymore. That's old school, etc. And so it was a bit of a journey to find my midwifery footing in the Central Florida community. And I began by doing home birth and eventually grew into a birthing center. But what was very clear about it was that I was always working with pretty well, middle class, mostly white women, people with agency, people with insurance, people with support, people with means. And there wasn't anything wrong with that. I loved every minute. But I also was very concerned that I wasn't seeing and reaching people of color, people of different demographics, and certainly marginalized people. And so I grew my work into serving those people. But I also found, oh, there we go, that we ended up with, and actually, you know what, if you start sharing my slides, that would be great. And I can keep talking. Is that okay? I'm wondering if something changed, but no? Okay. All right, I'll keep going. So anyway, what happened there we go. What happened was that I realized we needed to reach out to different communities to provide the same service and to create greater access points. So the National Perinatal Task Force showed up because of that. The National Perinatal Task Force was really the opportunity to create support for the supporters of that work. And so I was able to connect with Paula Rojas, and she's also going to speak. Maybe, Paula, if you just want to introduce yourself here, and then I'll continue with the slideshow.
Sounds good. Thank you, Jenny. Thank you, everyone at St. David's Foundation. I'm Paula Rojas, and I am a midwife and a community organizer. I'm a mother. I'm here in Austin, Texas. And I've been following the leadership of Jenny Joseph since 2010. My own path to become a midwife has started when I met you, Jenny. So for me, this connection between advancing racial and social justice in the world has very much been with midwifery because of what I learned from Jenny Joseph. So that is what inspired me to become a midwife myself and see this as one way that we can fundamentally birth a new way of life, a new world through the work of birthing justice and maternal justice, as we're calling it, as one key place to really kind of ripple to everything that we talk about as the womb to prison pipeline. It's not just impacting childbearing families, but it's impacting society as a whole. And that's why I joined with Jenny to work on growing the National Perinatal Task Force. So I'll pass it back to you, Jenny, as you
tell
us about the work.
Well, and I also want to point out, those of you in Austin obviously recognize this mural. The the encapsulation in this artwork of what this movement is about. And it was Paula who coined this phrase, this phraseology that we have centered our work around, because we are movement building and it is about justice. And we know that access to that is through love. And so next slide, please. So as I was saying, midwifery-based practice grew into a network which is blossoming and burgeoning nationally. And we're so excited about that. Again, what came up for me along the way, and as I learned from Paula about organizing and collective work, that what was really missing is, because let's face it, since the grand midwives, since before the grand midwives, the enslaved midwives, the indigenous midwives, midwives have been the bedrock of their communities for millennia. And midwives have always shared and learned their work through empirical means, through handing down, through generational ways. And we knew that this current iteration of birth work and perinatal support for our communities, particularly communities of need, is lacking the support for those that already are providing this work. We know birth workers are on the ground. We can all probably name local neighborhood people who are the strong leaders for, oh, I've got a pain, I need to see Miss Susie and she's going to tell me what to do. That we have always had that, but we had never, in my time here at least, seen a model that wanted to operationalize that. And so the task force is a collective. We are across the perinatal spectrum, from peer supporters, doulas, childbirth educators, lactation educators, midwives, doctors, nurses, researchers, you name it. Anybody who's on the ground trying to provide perinatal support to our areas of need and our communities of need, because we want to reduce and eliminate disparities. Those are the people who are in the task force. And right now, those are the people the task force is there to support. You can see a map in the corner of this slide where we've got our little spots where we've got developing safe spots and we've got official safe spots. We also have a council of midwifery elders. And this photo is our first gathering that we had as a task force, which was also in Austin, Texas. We were very proud and very happy to be in the city, to be able to come together and for the first time really be in fellowship. It was so amazing. Next slide, please. So this is the declaration, and I'll read it just because I think it's really important to just solidly place us here and have you guys understand what's behind this work. Guided by fierce love for our families and communities, the National Perinatal Task Force seeks to dismantle the braid of oppression impacting communities of color. We recognize strength and abundance in the breadth of our intersectional collective in order to harness the limitless power of our lived experiences. We believe all people have the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we care for with equitable resources to thrive in community. Furthermore, with a vision of reproductive justice and an equity lens, we believe in maternal justice, where even the most marginalized are able to birth with full human rights and self-determination, where we honor the powerful and sacred ability to create new humans, and where all childbearing people receive culturally grounded, attentive, quality, loving care. So to model the world we are birthing, we use collective organizing to shift the paradigm of reproductive health by addressing the root causes of inequity, building collective power, and advancing liberation for all. We transform the world via praxis, where our collective practices as perinatal providers guide our methods for transforming the world, making social change. So in solidarity with our partners in movements for all forms of social justice, we work in our local communities to advance maternal justice and collectively birth a more just and loving world. Next slide, please. So really it's a community-based model of healthcare, but also involving and incorporating the same components that we use and push forward for the family, for the mother-baby pair or the mother-baby family triad. We look at that work that we are all doing inherently, whether we are doing it through a structured program, through goodwill, through love, or just because. But we wanted the exact same experience for our providers, our perinatal supporters, our birth workers, our community health workers, our doulas, midwives, and so on. So I developed a model for the family, for the mother-baby, called the JJ Way, which is really a midwifery model of care, which is of course just then a patient-centered model of care. This work isn't about midwifery as the way we do everything and it's the only way. No, this work is about this patient centering, the mother-baby centering, the mother-baby family centering centers the community as well. So whereas in the patient sense, the model was to make sure and improve outcomes for women, we were able to show that we could get women full-term healthy babies that they were bonded well with, that they were breastfeeding well, that they were whole and hearty on the other side of the experience. We realized that what was going on there was we were simply providing 4 tenets: access, connections, knowledge, and empowerment. Next slide, please. And so we realized that we could also apply those same 4 tenets to our providers. That was the piece that was different. So even inside of the clinical setting, we made sure that the access points were rife and were plenty in the community, and that there was never a barrier. There's no, you can't get seen, no, we won't see you. We want to get you in so we can triage you and help find the next steps for you, make those connections, which is the second tenet, because without connections, we're not really doing anything. And if people don't trust you, they won't connect with you. And if they don't trust you, they won't come back, they won't be compliant, they won't share. And then once we got the access and connections in place, we knew the knowledge followed. And it was a two-way street. It's not just that we need to teach patients something or they need to improve their health literacy, but rather we need to sit quiet enough to listen and learn from them and understand their specific and distinct needs, their individualized needs, and that led to empowerment. So during the clinic, we have different care stations in different ways. We have different providers. I have equal amount of input in a medical setting from non-medical providers, childbirth educators, lactation, community health workers. In fact, in our system, in our JJWay system, everybody's equal. The healthcare provider is not in charge of everyone or on top of the hierarchy, but rather one of the team players at one of the care stations. So we applied this model to our birth workers in general and said, as long as we can create an access point, access to our movement, access to the collective, access to the care that the collective provides, and then connecting so that we can give support so that they can thrive in the work that they're doing, sharing of knowledge, technical assistance, all kinds of ways that we could help each other and learn from each other, a community of practice, and it led to empowerment. And that's how we've worked the National Perinatal Task Force. But let me hand over to Paula. Next slide, please. And I'll be happy to answer questions as well at the end.
Great. Thank you so much for that, Jenny. So I guess the layers that I want to add on is Jenny developed this beautiful, amazing model in practice in Florida. Anybody who's a birth worker of color, I would say in this country, not just midwives and midwifery students, but doulas and others, we've all kind of looked to the work that Jenny Joseph has done because it's been proven through research that the disparities in maternal and infant health outcomes can be reduced and eliminated with this kind of model, right? So though we have these persistent, outrageous, and kind of cemented in maternal and infant health disparities and inequities in this country that are not, we haven't been moving the needle even though we've been putting so much money in it, we do have this real life example of the work that Jenny's done as kind of a North Star for many of us. So for me, what I've kind of brought into it is, I think there's so much of it that was being done without explicitly recognizing the particularities. So one piece is that the work is culturally congruent, culturally based. So everyone on Jenny's team were from the person answering the phone to anyone, were also from the community being served. So there's real connection, there's past relationships there to the community being served. In a way that most, maternal health, prenatal care providers are not grounded in that way. And so we started to put together this more explicit model of what's happening and what's something that could be not replicated exactly, but here's kind of the main kind of the heart of how we could do our practice, everyone with their own flavor and, you know, culture and location. So in addition to the JJ way, the maternal justice model of care is something that we are sharing through the National Perinatal Task Force. And this is a model that I've been developing over time, but bringing together community organizing and midwifery to really understand that, like Jenny said in the beginning, the role of the midwives historically wasn't just to take care of pregnant families and babies, but really to build community and weave community together and actually provide what now we're calling mutual aid between families to those in need, and making sure that those who are needing it during the childbearing year are really cared for. So it isn't about self-care, but what we call in the National Perinatal Task Force, collective care. So some of the elements of the maternal justice model that we practiced here in creating Mama Sana Vibrant Woman, that was my praxis, was looking at the midwifery care for individuals, but in addition, it's a culturally specific space. It's collective education. So we do group prenatal education, group postpartum education and support, where it's culturally based, language based for everyone in that circle. There's also intentional community building activities. So everyone is invited into other things besides their own pregnancy care. And then there's the piece of understanding that while you're pregnant, you know that you're supposed to eat healthy or exercise or things like that. It's not about literacy in health education is not the fundamental issue, but the issue is that people don't have time or space or access. So in the maternal justice model of care, what we're practicing is like right on site. Before the pandemic, you could take the prenatal yoga class with free childcare in the next room with someone you trust, and there's a hot meal, so you don't have to cook, so you can stay for the yoga. All of these things are about praxis, which we're saying we're putting health into practice as opposed to just telling people what they should be doing. And all of this is grounded, if you see the stem of the flower, in the community. So what that means, and this is what we're kind of layering on to the JJ way for all the locals around the country, is that even if we're creating these beautiful, amazing programs of providing attentive, loving, culturally congruent care to pregnant families, like we've done in Mama Sana Vibrant Woman and in many of the other perinatal safe spots, the families still have to go back or still live in their homes and neighborhoods and are facing all the structural inequities of racism and capitalism impacting their lives. So, you know, unemployment, gentrification and displacement, right now, a pending eviction crisis in the whole country that's about to happen, food insecurity that's worse than ever. Those structural inequities still impact the childbearing year, regardless of the beautiful bubbles that we create. So as birth workers, it means that part of the care that we have to provide is to do intentional work to change those systems and structures. So that's what the maternal justice model kind of brings together, both the individual care and the community and social work of community organizing and building power, so that both can help create that bubble of protection of perinatal safety. Next slide, please. So how we're doing it at the National Perinatal Task Force, we have a number of different membership categories. So on the lower left is the perinatal safe spot, which is kind of the core of the National Perinatal Task Force. Perinatal safe spots are organizations around the country like Mama Sana Vibrant Woman, and we have a few others in Central Texas, Black Mamas ATX, Mamas on Bed Rest, and a few others. These are local organizations providing direct care to address maternal and infant racial health inequities. So we went from when we had the convening in Austin, which was May of 2019, I think we had about 29 perinatal safe spots. Before the pandemic, we were up to maybe 38, I think. And in the last year, I last just checked yesterday, we have 106 perinatal safe spots around the country. So many have been doing this work. They might be doulas, they might be midwives of color who are doing this very grounded work, who are connecting to our national network. So the perinatal safe spots are kind of the legs of this movement. What we've added now is a number of other membership categories, like Jenny's saying. There's others who want to be involved, but they're not actually a BIPOC birth worker care provider, let's say. So what are the other ways to support and participate? The supporters in the upper right hand are members who actually are just giving resources. That could be, they're giving funds, they're giving research support, they're offering to support even though they're not giving direct care. And we have many who want to play that role, so now we've created a category for it. The amplifiers on the bottom right are activist kind of individuals or organizations who are amplifying the message, the campaigns that might be coming out of the work, and the consciousness of this womb to prison pipeline that we have in this country and what it will take to dismantle it. So we've formalized that category of all of these people who are constantly supporting the work of the National Perinatal Task Force, even though they're not directly providing the care themselves. And then I think the fourth, which is to me the most exciting addition of membership possibilities for the network, are the igniters. And igniters are organizations that are working on reproductive justice, on advancing maternal justice without necessarily providing care. One great example is there's an organization in Rhode Island called Sister Fire, and they are doing community organizing with young women of color to challenge the hospital system, to allow doulas and birth workers in, to have different, to change regulations within hospitals, to give more autonomy to BIPOC birthing people and everyone who's birthing. So it's about organizations that are actually doing the organizing work to change systems, to change policies that impact childbearing families broadly. And it doesn't just have to be directly around birthing, but it can be anything that is working directly to change the social determinants that impact the health of a childbearing family. Next slide, please. So those were the four membership categories that we have now nationally. We have 106 perinatal safe spots, and then we have additional members in these other categories. But how we're building the movement, I wanted to touch lightly on some of the core principles of our work that Jenny alluded to. One is the yellow collective leadership. Unfortunately, in this type of work, we have a lot of individual kind of martyrs, I would say. The grand elder midwives who've come before us, who've really held full communities very individually. We have the amazing leadership of Jenny Joseph, who's also held so much individually for so long. And we're also losing a lot of our elders because of the intense stress and responsibility. So part of what we're doing is intentionally building structures of collective leadership, of shared leadership, for the work, both on the ground, helping perinatal safe spots develop collective leadership, but also the way we run the national work. And we think it's fundamental to really shift how we do our work to more shared leadership models, to be able to take care of everyone. And that leads me to the blue circle, collective care, another core principle. There's a slide later that will show you about this, but we're not talking about self-care here. Self-care meaning that on top of everything else that you're doing, either pregnant person or perinatal community worker, on top of everything else, you have to find time to take care of yourself by yourself and, you know, take bubble baths and get pedicures. That's not what we're talking about here. We're talking about weaving into the movement building work. We're weaving in spaces of collective care where we take care of each other and where we hold each other accountable to take care of ourselves. And that's very important if we're going to build this field and build this movement. And thirdly, what we're talking about is collective organizing. And what we mean by that is that it's very intentionally building the power of those involved. So that is both the childbearing families whose agency and voices after they've had their baby and had a little bit of time to recover are invited into the social justice collective work to bring their voice, to share their experience. And it's also the birth workers whose perspective is so key to help advance policy work, organizing work, and advocacy work. So that's how we're building the movement. Next slide, please. So the first step is knowing that you belong and how critical your participation is to this grassroots movement. So you understood each membership level's criteria that we went through. This is a map that doesn't have all of our latest on it, but we're basically mapping it out as we're growing this national network. And we are inviting others who want to join to be part of the network. Next slide, please. So yes, this is one of the fundamentals that we've been using to guide us from the very beginning when Jenny and I started to intentionally develop the strategy for growing the National Perinatal Task Force. And this is a quote by Audre Lorde that if you aren't familiar with, we used it a lot in Mama San, a Vibrant Woman in the beginning. It's from Bursts of Light, I think, a book that Audre Lorde wrote about when she was dealing with cancer herself. This is the quote: "Caring for myself is not self-indulgence, it is self-preservation. And that is an act of political warfare." So it's a really important quote as we're thinking about the work that we're doing and how we not only center caring for the childbearing families, but also what Jenny's talking about is how we care for this workforce of BIPOC midwives, doulas, lactation consultants, childbirth educators, etc. Being in that role is not the same as being a private practice midwife or doula, right? Being in this role, we are caring for families who are facing direct violence, systemic oppression and trauma day to day, and we're holding and caring for those families. So it isn't just being a doula or a midwife. It's much more intensive work. And so we want to make sure that we're clear about how we have to take care of everybody in that process. Next slide, please. And then this is Ella Baker, one of my life sheroes. If you don't know about Ella Baker, you should learn about her. She's behind so much of the civil rights advances in this country. She was kind of one of these not well-known people that was building the leadership of others, helping to build organizing, community organizing with students and community members her whole life, and kind of pushing a vision without ever being in the front, but always building that with others. And one of her quotes that I love is, "I have always thought that what is needed is the development of people who are interested not in being leaders as much as in developing leadership in others." So this is kind of the culture at the National Perinatal Task Force that we're trying to build, where each of us, as we come in and we are taking on these positions of leadership in the sense of holding responsibility for growing this network, that the role of each of us is really more like an organizer. And an organizer, what our role is to spark and support the leadership of others. So either the families that we're caring for, their voice, their agency, their experience, their leadership, or the birth workers that we're supporting. How do we kind of elevate the expertise of both the families and the birth workers in the movement building work that we're doing. And next and final slide. So we'd love to stay connected with you all. We have a report that we co-wrote, Jenny, myself, and Ishe Cole, that kind of lays out the models, the vision, the recommendations of what we think is absolutely possible in this country to turn around the inequities that have been, you know, it's centuries have brought us to this place of having the disparities in maternal and infant health. It's not by accident, it's by design that we have the outcomes that we have. And yet we are sure that it is something that we can turn around completely if we take on this multi-layered interdisciplinary approach that's both addressing families directly with love and care, and addressing systemic oppression and violence in local communities intentionally with those families as we build and transform the system through policy changes and building collective power. So I'm going to pass the mic back to you, Lourdes, now.
Thank you so much for your presentation. So this is the moment in which we put all our thinking caps and take a moment to ask our questions of Jenny and Paula. I am going to start with the privilege of the facilitator to first ask a question of the audience. This is a poll question that invites you to think about how does your work advance the creation of a perinatal safe zone here in Central Texas. So we're gonna have a poll. However, if none of the options in your poll are applied to you, please feel free to use the chat feature and reflect on how can you, in your own work, whether it's as an individual, as a somebody employed in an organization, somebody who leads an organization, how can your work advance the creation of a perinatal safe zone? And here's the poll. And you can choose as many of those as you can. There's, no wrong answer. And as you're going through the poll and using the chat to add any ad-lib additional thoughts that you may have, and while we're waiting for other questions to come in, I am going to pose my questions. And if I don't know if in the magic of the Zoom room, at some point we can have the 3 mock shots of Jenny, Paula, and myself showing up. But if that's possible, I will let the magic of Zoom allow for that. But in the meantime, I have a question for Jenny. Jenny, 2020 was a tough year, and I can only imagine that it did not make the work of the National Perinatal Task Force any easier. Could you reflect a little bit on how the work of the task force has adapted during the pandemic? Oh,
yeah.
Yes, great. Thank you.
Actually, you know what? It seems to not only have, considering this wretched pandemic that has affected all of us, all of our lives, all of our families, it has been an opportunity for us to find another modality which has proven to be, I would say, even more effective than how we were rolling before. So, for example, we had already begun meeting monthly via Zoom about 18 months before the pandemic hit. So we're already getting used to that way of connecting and working collectively, especially for our self-care, collective care sessions. But telehealth, who knew? Telehealth has, I feel, just given us so much more, because I think those of us that were already on the ground working with birthing communities were already providing our care, our health care, whether it was midwifery care, doula care, childbirth education, whatever. We were already doing that with respect in the middle of it, right? Like, I love that you've got in one of your poll questions, you've mentioned respect. Like, respect is the freest, cheapest, quickest thing anybody could do. You could do that right now, and it doesn't cost a penny, right? You could just do it because. But what we found with telehealth was we realized that you could very easily get disconnected or be in wrong connection with clients or with each other, because telehealth can create that distance very quickly, whether it's by phone or whether it's by video. And so we, I think, were just thrilled to find that as we were using that modality for healthcare and service delivery, we actually found that patients' feedback was, I just love this because at least I can still talk to you, at least I still feel heard, I feel seen, I feel that I'm not being dropped or ignored. Whereas you may have seen much of the telehealth response from the consumers have been, it's cold, it's not the same, we don't feel safe, we don't feel taken care of. So for the task force, COVID presented an opportunity for us to fine-tune and hone our telehealth skills and use another modality that we hadn't used maybe as much. And now it's another tool in our toolbox because we're reaching more people across vaster distances that we would have been able to or thought about had it not been for the COVID-19 pandemic.
Lourdes, you're muted.
You think that after 15 months doing this, that would not be happening. So thank you. I so connect with those reflections, Jenny. The technology can be a blessing, and it can also be a divider. So this idea that we have access, and that makes it great, but that we miss that human connection is something that we're gonna have to figure out. How do we do that? How do we create love vibes that can go through the Zoom room, right? And Paula, I have a question for you as well. You mentioned the maternal justice model. Could you talk a little bit about how all of the elements of the maternal justice model fit together?
Sure, I can do that. And before I do that, I did want to add a little bit to what you said.
Please, yes, of course.
I think it's really important. I think what you said just now, Lourdes, is it. What we've been developing in practice is how to provide loving, attentive care through the video, right? With intentionality to be so. And that is something I never believed was possible. I was so upset of having to do it this way because I'm a toucher and I rub the bellies and the feet and, I showed my love as a midwife through my hands, and I felt like I lost that. My hands were cut off. And so I think I learned so much from you, Jenny. You were the one that first said, no, we can do this. And so what we've followed Jenny's lead here locally in my work with Mama Sana Vibrant Woman as a midwife, where we've developed these packages with a little Doppler, which to listen to the baby, and blood pressure cuffs and urine sticks and measuring tapes and loving little, gifts and things and herbs. And we put them on the doorstep of the pregnant persons, and then together we do a prenatal visit through the screen where they're listening to the baby, but I'm counting and we're still talking, we're still connecting, we're still giving cariño and attention. And so that is what we learned from you. You immediately were like, I found the cheap Dopplers from China on eBay and we're gonna do it. And we've been doing this all over the country because of this network, and it works. And actually we could continue to do it beyond the pandemic for those that need it. So I just wanted to say that. For the maternal justice model, I think the dance between the local, it's all local, first of all, the care that we provide to direct support loving care to the childbearing families in whatever configuration that might be in each local. With Mama Sana Vibrant Woman, we have our way. With the JJ Way, you have your way. With Mama's on Bed Rest, you have your way. But that's the core layer. And the maternal justice model is just saying that is untapped kind of infinite power for organizing, and that's part of why I became a midwife, was like, wow, this is like the dream of a community organizer, is to become a midwife, because you get to play a role that builds really, really real relationships, like close relationships with people. that no other job allows you, you know, no community organizer job allows you to do that. It's very intimate, it's very personal, and it's very real. And to be able to weave those relationships of so much love and care into something bigger, where afterwards we say, people say, this was amazing. This is, you know, all my friends had to go to the hospital and get treated like crap, and I had this. And I want others to have this too, right? And so it's just a natural opening for people to say, and I want to get involved to make sure that others can have this too. And so we've had the most powerful kind of testimonies at City Hall coming from mothers with, you know, strollers and 3 babies, and, you know, to talk about what's needed structurally, systemically, policy-wise in our city, and have impacted our city policies in a way that no one else can, from that place of just tremendous love for our babies and families that I think is much more powerful than all the organizing that's about, you know, the anger against this unjust system. You know, that's true, it's unjust and we have real reasons to be angry, but there's something much more powerful when you harness this energy. So that's what the maternal justice model is doing, is trying to create that synergy between the two, and one feeds the other, because the policy work creates more resources for the direct care work and creates more space for the families to breathe and eat and have, you know, an apartment or whatever. And then the direct care work also is the place to nurture more leadership of directly impacted families.
Awesome. Thank you so much. So the questions are coming through the chat section. I'm going to get started. Eileen Nemi. Hi, Eileen. So glad you're here. Thank you for the work you're doing. Could you talk a little bit about funding and sustainability? What is your vision for how this work can be adequately supported? And I will say that we had some funders in the room. And I will also say that, Jenny, you mentioned that there are some things that are like free, like you don't have to think about it. So,
I mean, you know, and thank you for the question. And hi, Eileen. One of the things that really has struck me over the time that I've been working here, you know, the one thing that was pivotal in getting this work done and getting to the outcomes, right? Because we continue year in and year out, our prematurity rate is anywhere from 0 to 5% every year from a population who are normally the ones who have a 10, 12, 16, 20% prematurity rate, typically Black women and Latinas, marginalized people. What we found now is that when we go from this angle of providing as much as we can that's already free, or we know it's going to be uncompensated, we've created such a deep and rich model. There's so much in there. So for me, I'm looking to that change, that philanthropy hopefully will come to realize that investing in models that are so cost effective in the beginning. We are not talking about taking a caseload of 20 or 30 and fighting the fight and spending all kinds of money on masters prepared folk who are doing, no, we're talking about people who, many of whom are doing the bulk of the work, but have got an entry-level training. These women and people are more likely to be looking to grow up the pipeline career-wise later, and that investment is also going to come back, but rather they are on the ground effectively providing most of these kinds of competencies that don't cost money. Listening, human kindness, safety. These are things that we as human beings, this is the transaction here. You don't have to have a course, a diploma, a degree, a credential. So we use credentialed folk, of course we do, but we use maybe 1 or 2 in place of an entire army of credentialed folk that are breaking the bank to provide this work. So we acknowledge and we recognize that the power in this, and this is why I think funders, when they think it through and realize what we're actually talking about, we are providing a model that will absolutely guarantee safety, absolutely guarantee quality, and develops the workforce to continue the work. All that's missing is the sustainability, where we have inequitable payers and systems that don't want to recognize and reward the value of a community health worker, the value of a postpartum doula. We are pushing for postpartum Medicaid up to 1 year. Who do we think these providers are going to be? Let's face it, The OBs are finished at 6 weeks and not likely going to go past that. The cardiology team may or may not be interested in taking Medicaid for cardiology work. It's going to be the paraprofessionals, the birth workers, the community health providers who are on the ground for 365 days. That's why I'm hoping as we open our minds to different models, we have no other option but to think outside this box, because we're not making progress. And doing little of nothing is unconscionable, it's egregious, and we cannot sustain that either. So on a philanthropy level, this is an opportunity to invest in models that truly work, models that are proven. Our data year in and year out keeps coming back the same way, and bringing in a larger volume of folk who are going to benefit and reinvest into the communities that we care about most anyway.
Thank you so much. And I will say that also private and public payers, right? Like we want to mobilize charity, but we should be directing healthcare dollars where the value is accrued. And if the value is accrued with paraprofessionals who are providing that support, then that's where we should be sending backpacks of money. That's my humble opinion. So I'm going to combine two questions that came in that are sort of related to community health workers. One is from Shante Brown and Vanessa Sarria. So this is a mashup. It's about the role of community health workers in this role. And for Shante, who wants to train folks in the JJ way, how did you obtain information to implement the model?
I'll jump in there. The JJ way, your best information is if you want to go to the savinglives.biz, savinglives.biz. That's where we have all of our trainings. We do a vast range of perinatal trainings, and that website will help you to look at some of the offerings for perinatal training. The community health worker is the answer to all of our ills, every last one of us. And if you think about it, a midwife is a community health worker. A nurse is a community health worker. A social worker is a community health worker. The community health worker role is really already accepted, acknowledged, embedded, and available. We don't even have to recreate any wheel here. What I'm asking for is let's get some billing codes to go with that so we can have some actual revenue produced around that work. But let's all of us embrace that the community health worker as a hub, and most of our perinatal safe spots are being run by community health workers. They may have some other disciplines alongside, but they're in the community. Yeah, they know how to check your blood pressure. They know how to talk to you about diet and nutrition, but they know how to talk to you in your language in ways that you can hear. They will meet you where you are. That skill is not as easily pulled out of someone who's spent years and money trying to get to a higher level degree that then they have a hard time coming back down to, let me meet you where you are. Community health workers are the key.
So this is a quick question. It's a yes or no question. Paula, do you offer community trainings in a maternal justice model of care?
So we as the National Perinatal Task Force are starting some trainings nationally for our members in the maternal justice model. And then I think that we may be doing some of this training with you all, the St. David's Foundation for this region. So yes, there will be trainings coming. And I think for the community health worker piece, that is part of the training that we think. So it's the trainings that Jenny is talking about and the maternal justice model. It's like complementing each other to have the whole picture together. So yes, these are available.
So Anarita, stay tuned for more to come. I'm going to mash up two questions about young women coming from Lori Barzano and Liliana Cortez. Thank you for joining us today. Lori wants to know, can you expand on how this model extends to young girls and their introduction to young womanhood? And Liliana says that for an organization working with young girls, how can we start them early in women's health and educating them on their rights and options? Great questions.
Very good questions. We haven't got a specific team program. Some of the individual safe spots do. Our local in Central Florida does not. But one of the things that we know is working, and that is getting together as a collective. And so as women get together, it's not that hard to tap a young girls collective meeting or to help set up a Zoom for them, because it's in the conversations that we're doing our automatic and organic self-help and healing. Questions and answers amongst your peers are safe and are more likely to come forward. And so we've incorporated across the entire work, access to your information that you need, connections, knowledge, and empowerment. Always, those 4 tenets find their way into anything we do. And for young girls, it's exactly the same.
Awesome. And Terry Plain, you get the last question, my friend. How have public and private payers engaged with the National Perinatal Task Force to scale and move this issue of equitable reimbursement for perinatal care?
Beginning to see it coming now, finally. Thanks for that question, Terry. I have one family foundation that is a large foundation that has given us some funds to now look into building sustainability into our perinatal safe spots and easy access clinics so that we can scale. So they're supporting the work towards scale. And then we've also seen on the local where, you know, the March of Dimes and the local agencies are saying, okay, we can give supplies, we can hold baby showers, we can connect with you so that you can also connect and support our missions to reach our community. So I see the change. I think we're beginning to get that support we didn't have that before, but here it comes. We're grateful.
Awesome. Great. Thank you so much for joining us today and doing this presentation, Jenny.